Hey, so it's me. I just wanted to give a brief update about my 1 year post op um, appointment that I had with my neurosurgeon a little bit ago. I did take some notes just so I don't get lost or confused because I don't have the best memory. So, um, but anyways, I'm not gonna really get into any symptoms that I have, or most of the symptoms that I have, anyways. Mostly, I'm just gonna share what the surgeon said and as far as my needs going forward. So for a little bit of a background, um, I had immediate improvement directly after my needed brain surgery, the first one. And every month it just kept gradually improving until about the ninth month post craniectomy. Um, this ninth month, I had a sudden worsening of my symptoms and pain, and I kind of attributed this to each month I was increasing my activity to try to be 100% back to normal. And I assumed that maybe that month I just did particularly a little bit too much for my body to handle, and I needed to scale back a little bit. So, um, when after scaling back a little bit for a month or so, I noticed I wasn't really able to get my symptoms to improve, even from taking it as easy as possible. Being a mother and a wife, there's responsibilities that I have, but I was taking it as easy as possible. Um, and I was kind of just trying to ignore my pain and symptoms as much as possible because even though I did have a sudden increase in symptoms and pain, it still was nowhere near the like 11 out of 10 pain I was attempting to try to live through prior to getting that first surgery. Um, so anyway, and before I go into the next part, I just want to be really clear that I am not, blaming other people or anything like that, but this is just my interpretation of events and of myself. So, and honestly, it's really my own fault ultimately. But I'd expressed to other people how my surgeon had told me immediately after my first craniectomy that I would likely need another brain surgery, um, just because I had severe complications that he found during my craniectomy the first time that prohibited him from being able to do everything that he normally does for people. Um, so he wasn't able to do as extensive of a surgery as he normally would do for people because of the um, rare unforeseen issues that he found during my craniectomy. Now, mind you, my neurosurgeon is like the most sought after neurosurgeon for my conditions, for Chiari and Syringomyelia in our country. And so it's not a lack of experience on his part that he wasn't able to do everything that needed to be done the first time. It was issues inside my head that were serious, and they prohibited certain things from being able to be done that first time. So, anyways, every time that I tried to express, what the surgeon had said to me that I might be possible that I need an additional brain surgery down the road, and I try to like talk about that reality to people, I was always kind of met with, 99% of the time, met with, well, just don't think like that. So even though I knew it was wrong and a bad idea, I began to let myself not think about that reality. Um, and I began to allow my heart to believe that that wouldn't happen to me. So I went into so despite the increased symptoms and pain, I allowed my brain to kind of ignore all that and believe that when I met with my surgeon, he would say, these symptoms are normal and typical for people with your conditions, and the images look good. So that was my mindset going into my appointment. My neurosurgeon said that my MRIs, it looks like scar tissue had formed, and that can block CSF flow back up, causing a blockage again, which causes worsening symptoms and it can be dangerous because the complete blockage is dangerous, which is why I needed to have brain surgery the first time. So he said that he knows that people don't want to jump to have brain surgery, and he's at the top of the list of not wanting to do surgery if it's not needed. But he said that sometimes it is needed, and I explained I really don't want to have another brain surgery, and I feel like my symptoms aren't as bad as they were the first time, and they increased, and it sucks, but it's not anywhere near that 11 out of 10 that it was. And he explained that, like, that's a good attitude to have, but my symptoms likely won't aren't likely to be exactly how they were the first time, because I don't have the same issues that I had the first time. So I don't still have, they did a craniectomy. I'm missing part of my skull. So that skull is not still severely pressing into my brain like it was. For me, my skull was so tight that it had literally rubbed the lining of my brain thin, like translucent, which made it impossible for him to be able to do a Dura patch in the lining of my brain. Hence the reason why I said I might need another surgery in the future. Not only that, but I also had an abnormal bone growth on the inside of my skull, which had poked 2 holes in the lining of my brain, and I was leaking CSF fluid or brain fluid from those holes. And so he patched those up and shaved off that bone, so I don't have that problem anymore either. So he said it's not to think that my symptoms would be exactly like they were before. Like, I might not feel the same severity, but it still can be just basically, I might not feel exactly like I felt before, but that doesn't mean that something dangerous isn't going on now. So he said that, knowing how strongly I felt about really not wanting to have it yet, he said that he was okay with waiting a couple months, but he wanted to watch me very closely and meet with me again in like 2 months, and see and go from there. And he said that sometimes, even though he's the number one person who doesn't want to try to push surgery on anyone, sometimes he really has to strongly advocate for surgery if he sees it getting to the point where it could be dangerous for somebody's life. So he said that he wants to reevaluate again in a couple of months and just watch me really closely until then. If my symptoms get worse or don't get better, it's likely that I'm going to need to have another brain surgery, which obviously is not what anybody wants to hear, but it shouldn't have been shocking to me. And it's my fault for, kind of losing touch with reality. And so for being as shocked as I was to hear that. But anyways, I'm just going to close this video here by saying that I can't really explain to you how devastating that news was to me. I really get upset with myself because it shouldn't have been a shock. But ignoring my reality and trying to tough through my symptoms can literally cost me my life. I cannot do that, and I don't want another surgery at all. But like my surgeon said, he said, I'm young and I have a young family, and I really have to make sure that I'm here for them. And so anyways, my next video, I'll explain, is brain surgery for Chiari always a choice? And does the fact that I'll need another one, another more extensive, harder recovery surgery, does that mean that the first surgery that I had was a mistake or not needed? So those questions I'll kind of address on my next video, but for now, I will just end this here, and I hope that anybody else needing to have a revision surgery or just interested in this whole journey enjoys this video. But